if you find women as you push forward as the backbone of the country and the communities wherever you are. We thank God for powerful, praying, believing women, especially in this time, in this pandemic. And so I've been asked to share on something that not too many people might know of. You might have seen it. Back in the day, what they called it? Old-timers. Old-timers or doubting. Oh, he doubting or she doubting. You know, and the information is coming out. And now we are better able to describe what's going on. And I think we're going to have a wonderful time. Please stop me at any time if you have any questions or comments, and if you have anything you would like to share. Now, those who pay attention today, I have a few gifts to give out. I'll be asking you some questions, so please stay alert because I have a few gifts to give. All right. Are you ready? This is a spot moment. Just turn this down a little bit, please.
Oh, there we go. Fix it.
Thank you. All right, so technology is amazing. Hey? Let's give this team a wonderful round of applause. I'm telling you, it is not easy trying to do something like this in multiple countries and live. Look at where we are today in our technology. But as you look at Alzheimer's, for example, Alzheimer's is a form of dementia. It's a form of dementia. And it is also a form of what we call neuro. Write this down. I want you to make some notes. And why is this so important? Turn this off. Why this is so important is because the population is aging. You know, many years ago, someone who was 50 or 60 was considered old. But now people are living what? Now to 70, to 80, to 90, to 100 years and beyond. Is that right? Yes. And now, I had one of my oldest patients, 90 something. I think I'm a 90-year-old. And they're driving, they're moving around, they're functioning very well. I mean, it's the population is aging, but people are still functional. Is that right? And it's their right to do that. So as the population age, we're going to see some changes. Good? Very good. And so, that's good. Thank you. So as the population age, we're going to see more and more of different types of dementia. So let's look at the Alzheimer's type, because Alzheimer's is just one type. All right? And that happens when you have, these are the things you want to look out for. A decline in the previous level of function. Put that there. Number one, a decline in the previous level of function. And that can be with attention. The person is not, paying attention as they used to. Executive function, writing, reading, driving a car, going out and doing their regular shopping. What about learning and memory? Sometimes there are challenges with learning new things, or the main thing persons will notice is the change in memory. Now, memory can be a few things. It can be short-term memory, medium-term, or long-term. And you usually find that persons with Alzheimer's have short-term memory. Things recent, they have difficulty remembering. But if you ask them maybe which island they were born on, or a parent's name, they could go back and remember things a long time ago. But where they put their keys, or if they left the stove on, or whatever the case would be, it's a difficulty with remembering that. Their motor skills, being able to like I said, drive a car or do their normal shopping or cleaning. What about the social function? They have difficulty interacting with friends and family members like before. The second thing you want to look out for is the person has changes in their independence from what they used to do from day to day. All right? And things that they could have done on their own, they now need assistance with. Of course, when you make the diagnosis or when we make diagnosis of Alzheimer's dementia, it should not be some other medical condition that caused it, like a major depression or, you know, some other substance abuse or even a stroke, okay? This is what's called neurocognitive disorders. Let me break that down again slowly so we can all get the same page. It's a long word, but neuro means what? Brain. Anything related to the brain or neurological system. And cognitive means normal function. Okay? Functioning, mental function and capacity and their abilities in the mental arena. Are you with me? Okay, we're going to go through this. Now, there can be mild or major types of neurocognitive disorders. But I've been asked to talk on Alzheimer's. So let's get into some of the signs and symptoms. And I will also have this here. I'll leave this with your convention, and you can just make copies and give it out or email it to your other sisters in the faith or to the convention. And I also have a PowerPoint presentation that I will forward to you, and then you can share it later on. So we're just going to make it interactive this morning. When we look at Alzheimer's dementia, we talked about some things people call it Dowden or what else? Old-timers, anything else? Any other names that you know of it? Anybody? Doten. What else? Very good. You forgetting? What else? Anything else? Okay. Let's look at this Alzheimer's dementia. Of course, they have changes in their normal function. And then Alzheimer's dementia is something a doctor makes on at the office visit as a diagnosis when they've cleared everything else. Some of you said it. What other things can cause a person to have some memory changes? Anybody? Trauma. What type of trauma? Very good. Okay, so some major events. Okay, so it can be psychological. Very good. Anything else? Someone who would have experienced a trauma, a loss, grief. Yes, they can start to forget and go into possibly a depression, and the depression can lead to some changes in the function and memory and operation. Very good. Anything else?
Serious illnesses.
Pardon?
Serious illnesses.
Very good. Serious illnesses like what?
Stroke.
A stroke. Very good. You know, these are the things we want to take home. Don't just brush off elderly person as just, oh, they having, you know, memory problems and they doubting and they forgetting. It could have been actually they had a stroke, a small passing stroke we call it, or they could have a stroke going on at that time, or might have had a stroke and they recovered and didn't need to go to the hospital and you didn't know. So cognitive function is something you have to be very cautious of, in particular the elderly. Now, what is elderly? I'm not going to get into that today. Because one time ago, elderly was at a certain age. If you say that, no, okay? So we're going to leave that for today, right, ladies? Very good. So, very good. Someone else said another point. So, a stroke, what else? Someone else? Pardon? Okay. That's interesting. Yeah, very good. Thank you. excited. The answers I'm getting here is amazing. All right. But like you said, diabetes. What were you going to say? Which one, ma'am? Loneliness. Okay. Well, we got to help out these ladies. All right, very good. So if a person might have had, diabetes, they would have had, some recent infection. What else? Like meningitis or some other thing where they had a recent coronavirus. It's affecting the memory and brain function now as well. We're seeing that more and more. So infections in the brain. Or if the person had an infection to the lung and doesn't get enough oxygen to the brain. That is also another area. So what is the diagnosis? The doctor must rule out all of those other factors. That's my point. You got it? So be very cautious. When you see a loved one has this change in memory or in function, please just go ahead, get them to the doctor right away. Their sugar needs to be checked. Their blood pressure needs to be checked. They might have a recent infection, whether viral or bacterial infection. They could have a slip and fall and have a little bleed. They could have had a stroke. All right? So all of these things you have to rule out before you say Alzheimer's disease. That's the point. All right? But the thing with Alzheimer's that stands out the most is this. Alzheimer's usually has a genetic factor. So if you have a loved one who would have had Alzheimer's, you want to look into that. Okay? So that's family history. You also want to look at if there's a clear decline in memory and learning. If someone is in here today or, not in here, if you know someone and then they're functioning fine by this afternoon, a sudden change in memory and function, that's more than likely not Alzheimer's. That's more than likely something that has to be looked into urgently because it's a sudden change of mental function. Are you with me? Yeah. Alzheimer's is usually gradual. All right, one day the person forgot, where I put my keys? Where I put my glasses, And the glasses, have that happened to you before? You don't have Alzheimer's though, okay? You forgot where you put your glasses. You forgot where I put my coat and your coat on.
No, Dr. Collie, how about your glasses on your face?
Your glasses on your face, even worse.
You don't know where it is.
You left the water on. You left the stove on, boiling. All right? So day by day, you see different changes. They left the car door open. Left the front room door open. All right? And it's gradual. Gradual changes. Gradual things that is declining. Or you could have read and function, but now you're forgetting more and more little things you had the ability to learn on a family member. So it's steady, it's progressive, and the decline keeps going on. And sadly, as we have found out, Alzheimer's, dementia, there are no cures that we know, and there's no real full treatment as we know at this time. And once a person gets diagnosed with Alzheimer's dementia, they continue to decline. And it's difficult. I know we have someone who's going to talk about that afterwards, but it's quite difficult, just seeing patients with dementia. I had one example where someone was functioning well, but the wife thought it was something else going on. Why? The person kept forgetting. All right? And sadly, just kept progressing. Okay. Like I said earlier, there are no other signs and symptoms of having some other disease going on with the brain, either a stroke, a neurological, a mental, or some condition going on. They don't have lupus, they don't have that sugar diabetes that are not controlled, they didn't have a recent infection. Really, the diagnosis of Alzheimer's is made definitely, excuse what I'm going to say, at the time of autopsy, yeah? And at that time, when they checked the brain, there were certain proteins that they found collected in the brain tissue. So when a doctor makes a diagnosis of Alzheimer's dementia, it's really because everything else is clear when you see these symptoms. So let's look at some of the signs and symptoms. Like I said, I'll recap it. So signs being something your loved ones or others can see. Symptoms are what the patient presents with, okay? So the patient, like I talked about, memory loss, not being able to think and to function like they used to. Usually short-term to medium memory. They can remember things. Oh, I remember back in the day. But right now, they can't remember the children's name or the spouse name. They got to stumble Diane Ewing. They got to stumble a couple times to remember boy. Now, that's not for you if you have 30 grandchildren now, okay? You can miss some of those things. But if you have just one or two and you got to tap your head a few times, okay? And not functioning like they used to. The family members will see certain changes. Let's look at some of those same things. Forgetfulness, not functioning, being able to move around like they could. And sometimes if they go to a different environment, they get confused. See, because we don't realize how much in our home we know what to do by role. You can go to the kitchen, the bathroom, the front room. But some people who have Alzheimer's, if they take their relative or loved one to a different location, I mean, it's a difficult thing. They can't remember. They get lost, disoriented. Or if they go to the hospital, they're confused. And, or they go wandering in the street and people have to look for them. Now, let's look at some of the social behavior that happens. Persons with dementia, now some of them become suspicious. You've had any of that? Where they feel the loved ones are trying to hurt them or harm them, someone's out to get them. And in particular, they have these symptoms at night too. It's called sundowning syndrome, where at night they just feel, the behavior changes. They become sometimes more aggressive, more violent, more irritable. Have patients who just, with Alzheimer's, become sleepless. At night, they do a lot of wandering, and the family members have to go and hold them and try to restrain them, and then the cycle goes more because they feel, you're trying to hurt me and take away my rights and freedom, you're trying to lock me up and lock me down. And sadly, some people don't know what to do, and I don't advise you to do this. They don't have a caregiver, or there's no home for the elderly, so they lock them up in the home sometimes. I've had a lot of cases like that. Just didn't know what to do with the mother, the auntie, or the father. Can you imagine a big, strong, strapping man? And you got to deal with him with Alzheimer's and lift them and bathe him and help. Oh, my goodness. But they say once a... So you men, you better take care of these women. All right. Because this person now has to be a caregiver all over again. Sadly, with Alzheimer's again, so there is the signs and symptoms. Again, as you go to see your family doctor, internist, there's nothing much that can be done. There are some drugs that could have been used early on. If you catch it early on, there are some medications that are shown to slow down the progression. But if it's already set in, you're just making the patient comfortable. I advise patients just to make the loved one comfortable and secure. Keep them at home as much as they can where they're familiar. And then, of course, address the different areas. If they're becoming delusional and psychotic, seeing things, hearing things, you deal with that. If they're having difficulty sleeping, if they're more irritable, you try to address each of those areas. And of course, you try to give support for the caregivers. It's very challenging. We've seen so many of those, the family members, the children have to chip in. It's interesting because the person is still a real person. They might have a challenge in the memory. I know one wonderful lady. She's used to her independence. She don't want to be in free, but she want to go back to the island. Can you imagine that? She want to go back to her island, but they don't want her to go because, she might wander out and go into the bush and get lost, and then they can't find her, and, But she wants her independence, and you can't hold her back because she don't feel anything is wrong. Or the family members have to, change up the rotation. All right, you keep mama this week, you keep mama next week, you keep mama the following week, and have to rotate them around the homes just to make sure mama has all of her care. And that's compounded if there's other medical conditions going on. All right. So that's the treatment. There are some cases where a CT scan might be needed initially, or MRI. Patient comes in and we don't know if it's the Alzheimer's. Like I said, you have to rule out everything and then make that diagnosis. So lab works might need to be done. MRI, CT of the brain, just to make sure there's no infection, no tumor, or anything going on. Once that's clear, that's good. And of course, giving supportive care. So that's Alzheimer's in a nutshell. Remember these key pointers, Ms. Winters. One, it's a dementia. It's a form of dementia. Or another big medical term, when you talk to your friends and family when you go home today, you can impress them, say neurocognitive disorder. Break it down. Neuro, which means what? The brain. Cognitive, which means just your mental functioning. Whether it's memory, what all does the brain do? Memory, recall, thinking, analyzing, focus, coordinating, intaking, processing, anything in that area if it's affected. So neuro and cognitive. And you will impress everyone today. You went to this conference and you came out smarter than ever before. All right? There is treatment that can slowly help the individual if it's caught early on. Sadly, there's no cure. It's usually genetic, and it gradually declines and goes down and down and down. And now we know in medical science that once someone has been diagnosed with Alzheimer's disorder, sadly now, they have 5 to 7 years after that of living. Once they hit that stage, sadly, 5 to 7 years is the further life expectancy. Very sad. The behavioral issues, you address it each symptom at a time. It's a big social issue and family issue that you have to work together and manage that patient. The final and definite diagnosis of Alzheimer's is made really at autopsy when they look at the brain and do some studies. They find, or it's usually found with some proteins, what they call tau proteins, are deposited in the brain, and that's when they make the certain diagnosis. Okay? So we have to look out because the population is aging, and we're going to see more and more of these things. And if you have a loved one who needs care, all we can do is give you the support that you need. Questions, comments, please. I know you have burning questions. That summarizes that for today. We could go a little deeper. If you have some questions, I'll ask that because I know there's some pressing things. What causes it? Or maybe these natural things. Or tell me, let's talk.
Dr. Collie, there's a question from
Yes.
the chat. You said that there are medications to slow the progress of Alzheimer's.
Yeah.
That's
Yes.
Dr.
Who's that?
That's Emily Zamaric is asking.
Yes.
There
There is something called Aricept. Aricept, A-R-I-C-E-P-T. You Spanish people just Google that quickly. It helps in the early stages, and we do put some people on it if it's early on, and it only helps to slow down the progression. Yes.
All right. Any questions?
Any questions, Grandma? Yes, Miss Alden.
Yes, age, approximately, at what time does the kicks in, the age?
I was hoping someone would answer that. Very good. Very good. Very good question. The question is, at what age? The old reviews and old studies used to say about 70, but now we know we have something called early dementia. And people are now in their 50s developing dementia. In their 50s. Before, it used to be strictly 70, but now we see what is now called early onset dementia. Yes, ma'am.
What do you call that early onset?
Very good question. Again, genetics. The studies are still ongoing. Is it an environmental factor? Okay, is it our diet? Is it because of brain injury? Is it because of substance abuse? Is it because, at one time there was a talk, growing up, and early on in medical studies that people who use the deodorant with aluminum and stuff like that. You've heard that?
Yeah.
Or certain aluminum products, toxic metals, it was damaging the brain. All this is still being studied and learned more and more. But there is a protein called tau protein that forms in the brain. Now, how and why that does that, scientists are still researching it to see exactly why that happens. Next.
How does stress affect? How does stress affect?
How does stress
Affect the development of?
Very good. Very good question. How does stress? As you look at mental health, we in our setting, I'm sure it's the same in Nassau, the Turks and Caicos, and Grand Bahama, the stigma of mental health has always been there, but gradually with all of the information, people are realizing that mental health is very important. And what is mental health? Mental health is not mental disease. All right? So when you hear about mental health doesn't mean mental disease. I want to make that clear. Mental health means these are the things you do to keep your health, just like you keep your physical health, so that you don't develop diseases later on. So everything that helps the mental health, you're looking at from decreasing stress levels. Of course, all the studies show that loss of sleep affects mental health. Substance abuse, almost all of them, alcohol, cigarette smoking, or whatever, street drugs affect the brain function. This big thing about marijuana now, I'm afraid because I worked in psychiatry for 10 years. I know it's going to mess up people's brain. I had to get up my bed many nights to see patients and admit them. There's no doubt marijuana is going to destroy the minds of people. That's what it does. And so mothers, you have to pray. I've seen too many mothers cry, and too many fathers cry, and too many young people lose their mental health and damage the brain because of this substance in our community. I know it's political season, but I'm a physician. I got to say what I have to say here. I have to see them. Well, I used to see them, still see them. They still crying. Because why? Something they thought was innocent doesn't affect the brain. Marijuana kills the brain cells. All right? So maybe persons, like you asked the question, maybe people who use marijuana earlier on in their life or were substance abuser. I have this one patient, the wife didn't know that he had Alzheimer's because he used to drink so heavily that she just thought he was being drunk and, coming off his eye. Now, we know that heavy alcohol drinking shrinks the brain. Heavy alcohol drinking shrinks the brain. So some of you, we got to do a scan to see where your brain is. If you like to have your cocktails every evening. All right? But yes, if prolonged alcohol use shrinks the brain and damages the neurological system. So, again, mental health, very good. Proper sleep. Yeah, managing stress, we know that cortisol levels increase, okay, in the body during stressful times. It can affect the brain and brain function if you're constantly under that stress. Like you said, loneliness maybe, or the man leave you, anyway. So yeah, mental health. Take care of your health, and there's some supplements that can help with brain health. We know that, like natural stuff, walnuts, broccoli. The new thing now is we don't want to get too much into ginseng and ginseng, but these things help the brain out, brain function. Vitamin C is just a good multivitamin. Proper rest, staying free of toxin. Hydration. Your brain is 90% water. So if you're dehydrated, it affects your mental health, your brain function. Okay? If you have other medical conditions, you want to keep those sugars and pressure well under control. And there are some studies to say that coconut oil. You're from where? Guyana. You know about coconut oil. You all know about coconut oil. And eating the coconut oil. Some of the studies are showing that what they call MCT, multi-chain triglycerides, or the fats that is found in coconut oil, when you drink it, it helps the brain function. It helps gives fuel, ketones, give fuel to the brain. Those who are doing these ketone diets are saying that it helps the brain function, yeah? So that's a good question. So take care of your general over mental health. Hands, quickly, sir. I mean, who's next? Wait a minute. Go ahead.
Since you said you could detect what's getting Alzheimer from their short-term memory, right? But when they have that long-term memory and it is so good, is there another way that you could say maybe this person is onset of Alzheimer?
If they have a good memory.
They have a good long-term memory. So the short-term memory might say, oh, well, they just forgot that.
Very good question. Right. So Alzheimer's is not necessarily only short and long-term memory. It's just any changes in the mental function in terms of memory. Because they can have short-term or long-term or medium-term. You know, forgetting now, long-term, or way back. But usually they would remember, when were you born? 1940 on Long Island. You ask them what happened yesterday. Can't remember. Another important thing is in office we use what is called a mini mental test. We use it very often, which is a 20-point questionnaire. Okay, it takes a few minutes, and you go through that, and they should score 25. If it's based on the range they score. Some of the questions will be like, I shouldn't tell you just in case you're the car. All right, but it's based on a few questions, and you ask them to carry out a few functions in the office. I have a booklet with it, and patients who I think have Alzheimer's dementia, we get them to go through that exercise and see what they score, and then we can tell if it's mild, moderate, or severe Alzheimer's or dementia. Yeah? Yes?
You mentioned early onset. When you showing early signs, and there are some medications that can help to slow the process when you catch it early.
Yes, ma'am.
What is early?
Very good.
5 years?
Very good question. Early onset would be the minute you or your loved ones start noticing, forgetting things more than normal. And that normal is different for everyone. Because if you are, depending on your personality, your lifestyle, if you get up in the morning, you used to make breakfast, make the coffee, the tea, pack the bag for the kids, drive, drop them off, then go to work, and then, pick up the kids at 3, but now that's changed. Or it's different from that person versus someone who's a stay-at-home person who just gets up and cleans up a little bit. They might be able to detect that as quickly because they're just home and, okay, mommy just didn't throw the garbage or left the pot on the stove. But you now, who might have been used to a schedule and now you're just skipping that, that's not functioning. I would say anytime there is a change that you notice in family, especially family, because sometimes you think, oh, it just forgot. But if family starts complaining and say, sister, brother, honey, darling, husband, wife, you're really forgetting. You women don't round a man out now. They may have dementia. Right, guys? Only 2 of us say this is a woman's conference.
I think that's
All right?
start at age 25.
Huh?
I think that's the start at age 25.
Maybe. Or pretend to have it so
That was
we
one
can
of
watch
my
the game.
questions. Who is more likely to get Alzheimer's
Very
earlier?
good, very good. The studies have shown that it's pretty much equal now. There's no male more than female. I don't know if that's changed recently, but of late there's no real change. I've seen equal men and women with Alzheimer's dementia in our setting because it's not a sex-related disease. Yeah? But I think men put on more a little bit to forget things. Throw the garbage. Yeah, you remember. Women, this is a women's conference. Let's beat up on the guys now, right? Yes, question. And then I want some questions from Turks Island and Nassau, please.
Nassau has a question.
Okay. Yes, ma'am. Yes. Some of them were Oh, you have the mic? Okay. Mic lady, run. Let me hear that last piece, please.
Some of them will give us a self-help pill.
Who?
Self-help.
Salatul. Okay.
You heard of that?
Yes, ma'am.
Yeah, what is that for?
Very good.
Another thing. Another thing, women, some there are some of them very, very aggressive. They sleep at night under their pillow, they sleep down with the pillow, in their house every night. And some of them is so peaceful,
Very good.
so quiet. So what's the difference there?
Very good question. The question was, well, the first point was looking at the changes in behavior with the Alzheimer's. Like I said earlier, some Alzheimer's patients become very psychotic. They become paranoid, and they also have hallucinations. So Seroquel is an antipsychotic. What is used more frequently in this setting is something called Mellorilna. It's an antipsychotic that works very well with the elderly and gets better results. But yeah, so treat the symptoms. Like you said, some with Alzheimer's have no symptoms. Some become very delusional. They feel someone's out to hurt them, to harm them, or you, the loved ones, are trying to hurt them, harm them, or trying to put something in their food. Yes. And some have gotten, like you said, weapons and put under the bed or break down the door or all types of things. It's a very challenging thing for the family. And so, yes, you treat the psychosis, or you treat the delusion, or you treat the anxiety, the sleeplessness, and there's some patients who those medications help them really well to settle and help the family to catch themselves a bit. You're not drugging them to make them sleepy. You're just giving them, and it helps to put the chemicals in their brain back in order, and they're able to function, some of them, normally, and do little chores. And I encourage the family members to still give them little chores. Don't throw the garbage, go with you to the food store, bring them in the car, remember now, you're treating the whole person. You don't want to just throw them in the back room, lock up the door, hard it up. No, they still have life. They want to watch TV, put on their favorite show, take them driving with you, take them on the beach with you, keep them involved and active as well. Take them walking with you. All right? Don't just throw them away, mommy, up outside. Let's throw them. Remember back in the day, that's all they knew. Throw them in a back room, and when you're going to see great granny, she in the back room, go, child, go see her in the back there. No. Let them go catch the sun, walk around, go in the garden, do little activities with them. Don't give them any major tasks like driving or anything, but they can drive with you. Go to the beach, go to the food store, come to church, sing their songs like they used to, interact with people. Okay? So, let me go. Huh?
Over here.
All right. Quickly. 10 seconds each question. Go.
Okay, I just want to
Oh,
confirm.
yes. Okay. Yes, sorry. Who was it? Who was that? I'm sorry. It's hard. So this topic, normally people would ask to talk on so many things. When I heard y'all chose this, it was very impressive because most people don't talk about this. This was really good. This is a very good topic that you chose on because it's real. It affects so many people, and so many families are dealing with persons who, and the disorder is like, it's strange. It's like the person, I'm sorry, just you could have that loved one who was moving and active. Can you imagine a mother, a father, or a spouse, or a loved one just laying there? They can't recognize you, and they can't communicate with you. It's like they're there, but they're not there. They're there physically, but that's it. No more new memories. It's difficult. So go ahead. Yes.
My question is, from your vantage position,
Yes, ma'am.
what is the government doing about Alzheimer's? Because this is evidently something that is a part of us now. It's almost like the pandemic.
Yes.
So it's a part of us now, and it isn't going anywhere because each and every one of us in here, eventually, not that we all going to get it, but we are all aging.
Yes, ma'am.
And so therefore, medically and from a governmental treatment or there's going to be some facility, something that's specifically there to assist?
Very good question again. We are living, to answer you, I don't know of anything available for Alzheimer's. Again, this crept up on us.
Yeah.
Mama them, you know, when they got old, they went in the room and they sat in that chair and you go hail them and take them to a little Sunday dinner, and that's it.
Yeah.
But now we are an aging population, but we're not staying home.
They're aging well.
Aging very well.
Yeah.
And so now, we're in the generation who now say, oh my goodness, if mama or daddy or granny or you or I get in this place, we need to have this conversation with our families now. Because it creeps up on family. Now mama, who used to traveling and going to this one and going to Cat Island, going to Miami and staying 2 weeks in Washington with the other child, then coming back to Nassau, then going to Turks Island. Now, all of a sudden, dementia set in and you didn't prepare. You didn't have this conversation. You didn't have this